Today we're going to talk about the purpose of swaddling, why it feels so hard, and what you can do about it. As a pediatric nurse practitioner, one of the most common questions I get is, how do I swaddle my newborn when it comes to newborn care? As a mom, I swaddled my baby sometimes, but it wasn't just for sleep. It was anytime I needed her hands out of the way, like when I was nursing her or like suctioning her nose or something like that. But I had years of experience and training from NICU therapists um, on how to swaddle correctly and in a way that's developmentally appropriate. However, I know that most parents don't get this education. I don't really remember the first time I ever swallowed a baby. But what I do remember is working as a nurse in the NICU, it was a skill that you had to master. The perfect swaddle meant the difference between spending extra time doing a procedure like putting an NG tube or feeding tube back in, and your baby staying settled and sleeping between touch times. Let's talk about the purpose of swaddling. So, swaddling is done to make your baby feel secure and contained. And the reason for that is that it mimics the space that they have when they were in the room. It mimics the space that they had when they were in the womb. It also decreases the startle reflex. And that reflex, like when their hands go up like this, is usually what causes your baby to wake up when they're sleeping, especially in the sleep position that is recommended, which is on their back. Another thing that it does is it keeps babies from like scratching their faces. And that can be important for some parents because they're not comfortable trimming their newborn's nails yet. And as I mentioned before, in the NICU, when they're getting closer to going home, they usually have a feeding tube. So that'll keep their hands from going up and grabbing that and potentially pulling that out. The benefits of swaddling is that they usually sleep longer and more soundly because, as I mentioned before, it decreases that startle reflex so that they're not startling themselves awake. It also creates that familiar environment of the that familiar environment, that womb-like environment that keeps them contained and feeling secure. It also supports safe sleep recommendations because it removes the presence of loose blankets and things like that that could potentially come over the baby's face while they're sleeping. When should you stop swaddling? So, swaddling is not recommended once your baby starts to show signs of rolling. And this typically happens between 2 to 4 months of age. One of the things that's also important when swaddling is that the swaddle is not too tight. And the reason for this is you want your baby to still be able to move freely, but not, but still have an environment that kind of limits how far out they can move with the hands. So when we're talking about hip development, you also don't want the swaddle to be too tight, where they cannot move their legs and freely. And the reason for this is you want to reduce the risk of hip dysplasia, which means that the socket of the bone that's in the socket of the hip is kind of unstable and can move in and out of that joint. So swaddling too tight is not good because it restricts the movement, and we don't want that to happen. And I'll give you an example of different types of swaddles that I've seen that might be good for pictures, the newborn pictures, or I shouldn't say good, but they seem cute for newborn pictures, but they are terrible for everyday swaddling and for sleep. So what do you do if you don't know how to swaddle? So one thing you can do is you can ask your nurse when you have your baby, or your doula or your midwife to teach you how to swaddle. But once they go home, you're on your own. You don't really know. You might be thinking, which way did they which way did they fold the blanket down, and which side do I tuck under first? Is it too tight or too loose? Are they busting out of them as soon as you get them swaddled? They already got a hand out, like after you get them swaddled. So that's exactly why I designed the pea pod. One simple layer that removes the swaddle struggle and keeps you one step ahead of your little baby Houdini that keeps getting their hand up and out and like right here. It also simplifies swaddling and diaper changes in the middle of the night. It helps to provide better newborn sleep without the guesswork. If you found this video helpful, subscribe for weekly newborn care that is simplified and designed to reduce overwhelm. And you can also find additional resources for those first 12 weeks at thenurtureworks.com. Newborn care and safe sleep made simple. And if you're wondering why it seems like newborn sleep is so hard, watch this video so you can understand what's happening in those early days with your newborn.